What blood tests measure lipid metabolism? Have you ever wondered how doctors assess your lipid levels? Understanding blood tests that measure lipid metabolism is key to managing your health. Let's break it down. The primary test used is called the lipid profile or lipid panel. This test looks at various types of fats in your blood, specifically cholesterol and triglycerides. These measurements are essential for understanding your risk of heart disease and guiding treatment plans. First, we have total cholesterol. This number represents the overall amount of cholesterol in your blood. It combines all types of cholesterol and gives a general idea of your lipid status. Next up is low-density lipoprotein cholesterol, often referred to as bad cholesterol. High levels of low-density lipoprotein cholesterol can build up in the walls of your arteries, leading to plaque formation. This buildup increases the risk of heart disease and stroke. On the flip side, we have high-density lipoprotein cholesterol, known as good cholesterol. This type helps remove low-density lipoprotein cholesterol from the bloodstream, transporting it to the liver for breakdown. Higher levels of high-density lipoprotein cholesterol can protect against artery blockage. Triglycerides are another important measurement. These fats come from excess calories and are stored in fat cells. Elevated triglyceride levels are linked to increased cardiovascular risk and often accompany high cholesterol levels. Sometimes, very low-density lipoprotein cholesterol is also measured. This type carries triglycerides from the liver to tissues and can contribute to plaque buildup in the arteries. When it comes to testing, you might hear about fasting versus non-fasting tests. Traditionally, fasting was required to avoid temporary spikes in triglycerides after meals. However, non-fasting tests are becoming more accepted, except in cases of very high triglycerides where fasting is still recommended. For those looking for a more detailed assessment, advanced lipid testing is available. These tests measure the number and size of low-density lipoprotein and high-density lipoprotein particles. This can provide a better prediction of cardiovascular risk beyond basic cholesterol levels. Clinically, these tests are vital for diagnosing high cholesterol, monitoring treatment effectiveness, and assessing the risk of cardiovascular diseases like heart attacks and strokes. If your lipid levels are elevated, lifestyle changes or medications may be recommended to lower your risk. In summary, the lipid profile, which measures total cholesterol, low-density lipoprotein cholesterol, high-density lipoprotein cholesterol, triglycerides, and sometimes very low-density lipoprotein cholesterol, is the main blood test used to evaluate lipid metabolism. These measurements are essential for managing cholesterol and reducing cardiovascular risk.